Coming up on this episode of the Ready Test Go podcast.
If the pilot came on and said, I just want to let you know, I only have 20% of the data to get us to our destination safely, but I'm highly trained and very well intentioned, you'll be like, no, thank you. I'm not doing that, but we're doing that in healthcare. Instead of doing work and then digitizing it, we just jumped right to let's make it digital. Let's add an algorithm in there. Let's add AI support in there. And if the workflow's already broken, making it digital just creates digitized chaos. Doesn't actually lead to better outcomes for the people, for the system. There are things that AI algorithms can do well, and there are things that they can't. If you're just blindly trusting what's provided to you, there can be potential harm there. While you have that echo chamber of everyone saying this is really great, who are the people who are like, I will never use that? And what's their reason?
As she tells it, Nasim Afsar begged her way onto her high school basketball team. Her love of the sport blossomed from there into a college playing career and a passion well into her adulthood.
I think basketball has had such a tremendous impact on my life. I started playing when I was in high school. I was not good at all. I had not played before, but just watching the game, I was like, I want to be in there. I want to play that game. And so I actually ended up begging our coach to let me on the team, considering that I hadn't had any experience, and worked my butt off the entire summer while we were training and got to play on the team for 3 years. And I think, the things that really appealed to me, David, were the opportunity to get to function within a team where it is nearly impossible to do well in a game without relying on other people on your team, without them relying on you. The fact that you have different people with different skill sets, and that changes every time someone else comes in, and you have to continually think and change and problem solve. Your opponents are always different. They have different strengths. The acuity in thinking, responding, and working with others to get to a goal always appealed to me. And I was very fortunate that I went to an undergraduate where people went for the STEM fields and not so much for our athletic abilities. And so I was able to, with my extensive basketball experience, join the women's basketball team and continue to play in college. I think we lost like 21 out of 22 games per season, but we just absolutely love to play.
What Nasim loves most about the sport is the lessons that it teaches you along the way. It can humble you, frustrate you, and even help you find your place in the world. Whether you're winning or losing, or maybe especially when you're losing, the game constantly throws adversity at you.
We were in the trenches together. We still pulled together. We still worked hard. We still encouraged each other. We didn't give up just because it was obvious that we weren't going to be able to win during those games. The most fun memories I have, we were significantly down in points, and the team continued to pull together and show up on every single basket like we still had a hope, even though there just was not going to be any hope of being successful. Sometimes you're doing well and sometimes you're not, but how you show up and how you continue to work with the team to address the challenges of the day are just as critical, whether things are moving in the way that you want or not. Probably even more critical when they're not moving in the way that you want. I feel like that's definitely a critical lesson. You can laugh and have good time, even when things are not going well.
And that's emblematic of the business world, where working with others towards a goal means so much more than individual accomplishments.
A game is much bigger than you. You could have a really bad game, but the team does really great, and that's what matters. The ultimate goal surpasses who you are and your individual abilities, and I think that's very relevant in the business world, where you could work really hard and you could do your best. Stuff could still go wrong, but you're working towards a bigger goal and are trying to achieve something that is much larger than who you are. So you get up again and you try again and you work harder and you continue to evolve with the team that you have. And the most worthwhile things that we do are not done individually. They are done in teams working through that common purpose.
Nasim has been delighted to see the growth in women's basketball over the last few years, from the difficulty in securing tickets to the excitement inside the sold-out stadium. This LA Sparks fan loves the spotlight the sport is receiving. In fact, it might even be part of the reason why she's lacing up the shoes once again.
Love watching basketball, period, but love watching women's basketball. We love the WNBA and the Unrivaled League. I have to tell you, it's so exciting, David, to see over the years as we've attended games. It's become harder and harder to get tickets and to get good tickets because participation has gone up significantly. I'm in LA, we're big fans of the Sparks, and we're at a game this Sunday, and we were reflecting on, wow, this stadium is full, and it's way more energized and engaged than any other years that we've seen it. It is incredible to get to watch the game and honestly get to see the professionals do it. I'm actually trying to train to join an adult league, so we'll see how that goes. Maybe I'll come back for an update.
This is Ready Test Go, brought to you by Applause, the podcast on software quality and digital experiences. I'm David Carty. Today's guest is bonafide baller and healthcare technology leader, Dr. Nasim Afsar. Nasim has extensive experience across operations, quality, and digital strategy, especially in the healthcare industry. She is the managing director of Healthcare Innovation Partners and previously served as chief health officer at Oracle, in addition to holding executive leadership roles at UCLA Health and UCI Health. She is also the author of the book Intelligent Health: The Movement to Unify Data, Harness AI, and Empower People to Thrive, which came out in March. Too often, organizations design technology around departments instead of the people the system is built to serve. When the human perspective is treated as an afterthought, AI can actually create more burden than benefit, no matter how advanced the technology is. So, what separates meaningful transformation from simply layering new tools on top of old processes? Well, in high-stakes industries like healthcare, trust is personal, relational, and operational all at once. Let's check in with Nasim to learn some of the lessons that enterprise technology leaders can take away from the healthcare industry about building products that work in messy, real-world environments. Nasim, when we think about healthcare and health tech, these are industries with a deeply human focus, but healthcare workflows are complex, and that raises the stakes for digital products and services. Where do you see AI fitting in naturally and effectively into those workflows, and where can it create some burden or confusion?
That's a great question, David. And I think, it's interesting to me as we look at healthcare and the integration of AI into healthcare. I think there's lessons learned across different industries that also share complexity and high stakes, like the well-being of human beings. I think where AI fits really well is where it removes friction from the day-to-day work. So an example of that would be documentation. When you go as a patient to a doctor's office and you're engaged in conversation, I think as we've noted over the past decade, the eyeballs, the physician eyeballs are oftentimes not on us. Her eyeballs are on the computer trying to rapidly type what we're saying. Well, we've been able to integrate generative AI models now where the doctor and the patient can now engage in regular conversation, and the model will pick up the language, sort out what is actual medical knowledge that needs to be, or medical details that need to be documented versus what's conversational and can be left out. So again, an area where you're removing friction and really enabling human beings to connect. And as a result, David, be able to get higher level, higher grade information. There's a lot of examples like that in healthcare, especially when it comes to administrative workflows, where AI can really fit seamlessly and reduce friction. Prior authorization is another one. So that's the process by which you need to get something done, like seeing a specialist or getting an MRI. and that request has to go to the insurance company with justification about why you needed to get a prior authorization for that scan or visit to happen. A lot of those can happen instantaneously through AI models for the large majority of what we need prior authorizations for. So again, instead of you having to now wait weeks to get the authorization, then calling back to schedule the appointment, literally instantaneously, you can know that you have authorization. You can move forward and schedule that follow up right there when you're in the office. So those are areas and spaces where you can take the burden of work away from people, where there is not this is not cognitively taxing work that's being done. This is not work that needs to be done by a human being. It can be automated, it can be removed to give the human beings the freedom of time and mental bandwidth to kind of do the work that only people can do, which includes a higher degree of problem solving. It includes connection, communication. So I think those are again spaces where things are done well. I think, you also asked where does it not work well? I think where it doesn't work well is where we have complex workflows, and we just decide to go ahead and digitize them. And we saw that with the adoption of the electronic health records more than a decade ago, where we had a number of workflows that were no longer relevant in a digital world or needed to be updated and rethought with how healthcare had advanced. But instead of doing that work and then digitizing it, we just jumped right to let's make it digital. Again, let's add an algorithm in there. Let's add AI support in there. And if the workflow is already broken, making it digital just creates digitized chaos, doesn't actually lead to better outcomes for the people, for the system. And so I think those are the spaces in healthcare where I see oftentimes we struggle with and really have major pain points with digital transformation, is taking things that again need a rethink and a modernization, and then adding AI to it to let's just add AI on top of something that's broken.
Yeah, those are great points. And AI can influence a lot of areas in healthcare, whether we're talking about access, triage, documentation, care coordination, all of these areas and more. But it ultimately comes down to a trust issue, right? As we talked about in our intro, trust in healthcare is personal, relational, and operational all at once. So we're talking about the patient perspective, the practitioner perspective. It can be challenging to try to achieve all of your goals simultaneously. So how should leaders think about trust when AI is influencing all of those areas?
David, that's such a critical question. And I actually have an entire chapter dedicated to trust in the book because, when it comes to our health and care, trust is at the core of, are you going to take a recommendation that you are given by an AI algorithm, or honestly, by your physician for that matter? There are many times that people don't follow recommendations because there's a lack of trust between them and their clinician. So that issue of trust is really critical as we're thinking about implementing AI in the clinical space. And to me, there are kind of two main categories of trust. I think about the first one as trust in the algorithm. So both as the consumer of health and care, as a healthcare provider, as a nurse, as a staff member, we all need to have trust that the algorithm is going to do right by us. That if I am asking for advice, that what I am going to get in response, again, whether I'm a patient or I'm a clinician, that it has robust evidence behind it, that it is based on factual and evidence-based findings. So there's kind of that first stop of, can we trust the algorithm? And we've heard over and over again where physicians have failed to adopt AI solutions. It's been because they didn't trust it and they were concerned that it was going to harm their patients. I think on the consumer side, we have been more trusting of AI algorithms when it comes to our health and care. And unfortunately, some of that has been to the detriment of the people who were seeking advice. So there are things that, again, AI algorithms can do well, and there are things that they can't. And if you're just kind of blindly trusting what's provided to you, there can be potential harm there. So again, that trust in algorithm becomes really critical. I think the second part of trust that's really important, David, is trust in the institutions that are creating and implementing these algorithms. I think we have to feel like our best interest is at the center of these algorithms by these organizations, that our data, our privacy, especially when it comes to our most intimate data, which is health data, that is protected and honored, that it is not leveraged against us in different ways. And so trust in the institutions becomes another key piece. I was giving a talk recently to an audience across lots of different industries. And I was like, I'm just curious around where our trust level is across the different large language models. And raise your hand if you have high trust. And I went through five different large language models. I won't share the results of what this audience said, but it was clear that people had different levels of trust in the organizations that were, putting out the large language models. And I think, again, when it comes to health and care, that's going to play a larger and larger role.
Yeah, that's really interesting, especially at a time when we're seeing that patients are exercising their choice in the marketplace, maybe more than they have in the past. You can choose a practitioner. You might not necessarily be able to choose the technological infrastructure that is helping that practitioner do their work, right? So it's kind of an interesting time that we're at.
Yeah, you're absolutely right.
Yeah.
And I think, again, this is where yeah, I do strongly believe that the consumer at the end of the day is going to have a voice in how things move forward. I think at this point, the consumer is deciding where they are going to put their data and where they're going to share that. And I think that that's an evolving picture, right? That is continuing to evolve as the consumer becomes more educated. But I think systems similarly, as they look at who are they partnering with, where are they trusting their work. This again, I think trust comes back into play.
Yeah, absolutely. Especially when you think about how complex a lot of these workflows are and the healthcare system is. And you've worked in a lot of different segments of that. You've worked across health systems, payers, public health, retail, pharma, and technology. That's a lot of different stakeholder perspectives. So what does that broad ecosystem for you reveal about why healthcare is so difficult to design around that individual?
Yeah, I think essentially the challenge in healthcare is that we have got many large stakeholders who are involved in our health and care, right? There is the providers and the hospitals and healthcare systems. There are payers. There are pharma companies. There are our employers. Then there is a whole host of pharmacy retail and grocery stores and food and beverage companies. There are technology companies, all the way from startups to very mature organizations. So we have got a lot of different stakeholders in this very crowded marketplace, David, with similar goals, but their path to achieve that goal is often at odds with each other. And they all have a vested interest to continue to get the margins that they need to survive, whatever that means for them, whether they are non-for-profit or for-profit, whether they're dealing with margins of less than 1% or margins of 40%, their definition of what it means to survive, they have their own set of priorities that they're moving forward on. And again, this is oftentimes at odds with each other and makes it really difficult to coordinate around the only constant that is shared between all of them, which is us, the consumers of health and care. Because at the end of the day, as the consumer of health and care, I buy groceries and engage with food and beverage companies. I look at which provider I'm going to go to for health care. I'm looking at which payer is going to help support us in that journey. I'm picking grocery stores. I'm engaging with tech companies, whether it is a startup or it is a well-established wearable that I'm choosing. I am the only constant across all of these stakeholders. And so this concept of intelligent health is, how do we actually get all of these stakeholders, instead of kind of continuing to operate in their parallel silos, how do we get them to realign around the only constant between them, the individual, and now focused on the health of the individual, as opposed to either contributing to it or paying for it once illness happens. And so again, I kind of talk about that reorganizing that needs to happen for each of these industries so that they can continue to deliver on their mission and their margins, but doing it around the health of the individual versus competing with each other for market share around what ultimately leads to our collective illness.
Right. And there's a lot that our audience can take out of that, even if they don't work in healthcare or adjacent industries, which we will get to a little bit more later. Many healthcare organizations are still operating within legacy systems on top of the regulatory constraints that they face and the deeply embedded workflows that we talked about. What separates meaningful digital transformation in this space as opposed to simply layering new technology on top of old processes?
Oh, David, that is such a great question. I wish everybody would ask that question before they come to implement digital solutions. Again, no matter what field you're in, because I do feel like, unfortunately, the large majority of the time, the 90% of the time, I would say, in my experience in healthcare, we are adding digital solutions to broken workflows and broken systems. And this kind of goes to our conversation earlier versus what is true. And we call that transformation. What is true transformation is to clarify, what is the outcome that we are trying to get to? How do we redesign our workflows, our operations, our systems to get us to that outcome? And now, when and where do we need to apply AI solutions to really enable that transformation to get us to goal? That is very different than saying, let's just throw AI at this part and get to do it a little bit faster, a little bit better. It's a complete rethinking and redesigning of those workflows and operations. And it's sad, but you can see kind of when that doesn't work, because that's when you see that those outcomes that you so value have not moved in the right direction. So we see that, unfortunately, in healthcare. We have spent a lot of money, a lot of resources, a lot of intellectual capital to add digital solutions, yet outcomes for the most part, while we have had some incremental improvement, outcomes for the most part year over year have not significantly improved. We have a sicker society that costs more money, and we are no better, even though, again, we've kind of put forth a ton of different point solutions. So I think that's a really it's a really deep question that needs to be asked and answered prior to starting down this path.
So, if we're thinking about in practical terms what a person centered healthcare system would look like, whether we're talking about from access and waiting rooms to information flow, expertise and follow up care, what does that look like? And how far are we away from getting there?
Yeah, I think, a person centered system ultimately has a couple of kind of key characteristics. One is it has to move from being reactive to being proactive. So when we look at building this person centered system around the individual, we are not waiting for things to go wrong before we intervene, because that's when we go to the doctor. We're not feeling well. Once a year we'll do a preventive visit, but the majority of the time we're seeing and seeking healthcare when something is not right. Instead of that, you can continually get feedback on how your life could be supported to reach the health goals that you want and being proactive in preventing disease. Um, that ultimately requires us to be able to unify data from different aspects of our life together and be able to apply intelligence to the totality of that. So, the big challenge that we have in healthcare today is that we make healthcare decisions based on only 20% of what determines our health, which is the data that comes from traditional healthcare delivery systems. The 80% of what determines our health is the air we breathe, the food we eat, the stress we carry, our genetics, our habits. That 80% for the first time is digitized more than ever before, or can be digitized, or is available to the consumer. You can get genetic testing, whereas 20 years ago, that was not something that we could easily do. And so now we can connect that 20% with the 80% and get to see the whole person, not just the clinic part of them, but the whole person, and get intelligence about the whole person. And I think, again, David, when you think about what what other area of life would you be okay making serious decisions with only 20% of data? Like that's just not acceptable. You wouldn't get on a plane if the pilot came on and said, I just want to let you know I only have 20% of the data to get us to our destination safely, but I'm highly trained and very well intentioned. You'll be like, no, thank you. I'm not doing that, but we're doing that in healthcare. So to me, again, a person-centered system has to start off with a foundation of how do we bring all of this data together and how do we actually connect it and apply intelligence to it so that we actually can see the whole person. And then the kind of key piece of that is we have to own it. That data has to be consumer owned and consumer driven. It cannot be a person-centered system if healthcare delivery systems or payers or pharma or a tech company are doing things on our behalf with their interest in mind and saying that this is person-centered. It's person-centered because I own the data. I get to see the intelligence. I get to decide who I'm sharing it with, how I'm sharing it. I think that's going to be kind of the big hurdle for us to overcome.
Right. Autonomy goes a long way there. And by the way, if any of our audience is listening to this on a plane, relax. This is not a real example. Your pilot is very, very skilled, I'm sure. So don't worry about that.
And your pilot actually has data across lots of different
Yes.
areas, which is why air travel is as safe as it
That's
is.
right. That's right. It's a great point. So let's step outside of healthcare for a minute. Many of our listeners, as I mentioned, they work in other industries. What can enterprise product engineering and AI leaders learn from healthcare about building technology that works in messy, high stakes, real world environments?
Yeah, I think the principles are very similar, Davids, and I think we've talked about a couple of those, but let me highlight them a little bit more. I think starting off with the consumer, and again, coming from tech, I know a lot of times we talk about the consumer, but it's our view of the consumer, not actually sitting in rooms with the consumer and all the diversity that he or she brings to the table to say, how do we actually design around the needs of the person. I find that a lot of times we tend to design for ourselves, which is not wrong, but if you're designing at scale, we tend to not necessarily be representative of all of our consumers. And so, really being deeply rooted in what does the consumer need is absolutely critical. I remember back in the day when I was in a healthcare delivery system, and I took discharge instructions to one of our patient family advisory councils. These are kind of people who had been in the hospital, discharged from the hospital, either the patient themselves or a caregiver, usually a family member that was very close to them. And I asked them, these are the discharge instructions we give all patients. Go through and cross out things that you don't understand. Now, this is just the template, right? So it's not the go do this, go do that. It literally is just the template of what you're supposed to do. And I got these forms back, David, with 50 to 70% crossed out, where people just didn't understand what we meant in this template. And here was something that was given to every single patient who got discharged. Thankfully, we completely redesigned it. But again, it goes back to very well-intentioned people sat together and came up with what that template needed to look like, but we did it from a healthcare perspective. If you don't design it around your consumer for the consumer, there is a big miss, right? I think the other kind of big lesson that we talked about that applies across industries is having clarity around what's the outcome that you're trying to reach, and making sure that you're staying really honest with yourself in, is what I'm putting out in the world really moving that outcome? And it's not just sales numbers. That there has to be kind of a bigger purpose for how you are adding value to the world, and you have to be measuring that and ensuring that the new stuff that you're putting in is really adding that value to people. And I'd say kind of the last lesson is what we talked about earlier around doing genuine transformation versus lots of different point solutions. Again, across industries, I see people implementing an AI chatbot, right? That's like dime a dozen. You've got AI chatbots all over the place, but it's not giving me ultimately the information that I need from that industry. That's because the transformation that needed to happen that would then enable that AI chatbot to be helpful is not there. So how do we move again from those point solutions to really rethinking, redesigning these systems and implementing AI in a way that's actually supporting transformation towards an outcome?
I'm curious, from your experience as a technology and a healthcare leader, was there a wow moment for you where user feedback, patient feedback, whatever it may be, really opened your eyes to how perspectives can be marginalized like that?
You know, Probably one of the most impactful examples that I can think about is during the time of COVID, David, where um, we, almost overnight implemented a telehealth solution because, as you recall, clinics kind of shut down. So we went from helping take care of thousands of patients a day to all of a sudden you're like down to zero. And so we implemented telehealth solutions right away to try and open up spaces and at least enable people to connect with their providers. I was a chief operating officer, so I was watching these numbers initially, like on an hour to hour basis. And there was the wow moment where I was like, look, we did this. People are coming. We're actually taking care of people. We're actually able to be there for people during what is really a scary time. And that's incredible, like what we've been able to do through technology in a really short period of time. And I have had an amazing team, and we had always talked about unintended consequences. And so we had thought, as we were implementing the telehealth technology, what could potentially be some unintended consequences. And one of the things that we had come up with is, well, if we have elderly populations or vulnerable populations who are not as comfortable with technology, we could fail to help support them. If we have people in areas where they don't have enough bandwidth or are not able to connect with us through technology because they don't have a smartphone where they can download this stuff to be able to do it, we could potentially exclude them. And so we were also looking for some of those elements and looking at the data. And that was kind of my bigger wow moment, was seeing that they were surprisingly the age difference was not as big as we thought it would be. But surprisingly, there were zip codes that were completely missing from our telehealth activities, people in areas that we were seeing in large numbers in our clinics that were located in their communities. But when it came to telehealth, they nearly disappeared. And so, because we were looking for that, once we saw that, we got back to the drawing board around, hey, how do we help support this? So, some of that was having language services that can help patients actually implement the technology and be able to connect. But we realized that that just wasn't going to be enough. And so, we started based on learnings across the country. We started partnering with community centers and churches in these neighborhoods to have clinics on Saturdays and Sundays and be able to be physically present on site in areas where people were gathering, to then be able to see people and take care of people. And so I think the user feedback in this case was there was no feedback. People kind of disappeared off. But because we were looking at unintended consequences and watching out for where our technology could potentially harm people, we were able to turn around really quickly and actually be able to see large numbers of people who weren't coming to our clinics in their neighborhoods and seeing us, because now we were available on a weekend. We were actually in a space that was trusted by them, and that we could take care of them in those spaces.
Do you have a few pieces of practical advice for organizations that are trying to march toward some of the people-centric design outcomes that we've been talking about today? The idea can be really fundamentally solid, but it's more complicated in practice to put it together.
Yeah, I think, in addition to a lot of what we already talked about, David, I think where I see companies, especially startups, fall short is you surround yourself with a lot of people agree with what you're doing and the way that you're doing it, and you kind of create an echo chamber for your solution. And again, I've seen that in big organizations and I've seen that in startups. And I think if you ultimately want a people-centric design, you absolutely have to surround yourself with the people who think that the idea is really horrible and understand why do they think it's horrible? Why do they think it's not going to work? Because it's really easy if you're in an echo chamber to keep moving forward and designing something without understanding what the reality of the solution could be for other people. I was advising a startup around a really great solution, and I was bringing up a couple of what I considered kind of major gaps in their solution, and they're like, "Yeah, but this professor at this well-known academic medical center wants to talk to us about this and thinks this is a great solution. And there's this tech company that wants to talk to us and thinks it's a really great solution. And there's this payer that thinks it's a really great solution." I'm like, you got a great solution. I'm not doubting that. I'm just saying none of those folks that you mentioned are actually going to be your end user.
Right.
And while you have that, again, echo chamber of everyone saying this is really great, who are the people who are like, I will never use that? And what's their reason? And it doesn't mean you listen to all of that or you implement changes for all of that, but it does mean you have to listen to it and you have to understand, because in that there will be some major blind spots and gaps that you just didn't pay attention to, and you'd never know unless your people-centric design is actually grounded in lots of different people.
So, just to bring it back to what we talked about earlier, what would ultimately convince you that AI is helping create not only a more intelligent healthcare system, but a more humane one? And what would that signal to leaders in other industries?
Yeah, I think that's a really key point, right? Not just that we have better solutions that are leading to better outcomes, but that it is more humane, right? And I'm going to sidetrack for a bit to say, um, when I look at how healthcare is delivered today, if you are a person with choice, if you are fortunate enough to have choice, you are likely navigating your care between a series of different stakeholders from well-established healthcare delivery systems. That is not humane. Having you go and shop around and have to kind of piece together your health and care is not humane. If you do not have choice, then you're in a much more difficult area where you don't have access to some of the most basic things that we need. And so I think, when I think about AI making healthcare more humane, we have to have concrete. And again, I'm an ops person, so I'm going to always go back to, like, how are we operationally building this into systems, and then how are we monitoring by outcomes that we are getting there? So we have to clarify what are those humane outcomes that we're aiming for. That includes the quality of care metrics that we want to track, follow, make sure that they're improving. It includes access metrics for, again, whether you have the ability, whether you are insured and have choice, or you're insured and don't have choice. We have all noticed over the last several years that time to get in an appointment has gone up significantly. So, and again, not humane. So what are those metrics that we're looking at for access? What are the metrics that we're looking at for cost? The fact that so many Americans go bankrupt as a result of healthcare costs, or sadly don't seek care because they are concerned about cost, is not humane. So a diverse set of key metrics for us to say, if we have designed this right, that these metrics are getting better from today, and not incrementally better, David, because I feel like we've just spent so much time in this country focused on, like, oh, we can get it a little bit better. Where we are is unacceptable. We have to think about that transformative change, not just the point solutions. What does it take for us to have fundamentally more humane care, for people to actually feel seen, heard, and cared for? And then ensuring that the solutions that we implement are actually delivering on those metrics at the end of the day, and that we're continuing to optimize the system until we get the results that we need out of what we've implemented and the technology that we've set forth.
Lightning round for you, Nasim. First, what is the most important characteristic of a high quality application?
It's got to deliver consumer value. I think an application is not going to be worth anything if it's not giving the consumer the value that they're looking for out of it.
What should software development organizations be doing more of?
Oh, I'm going to go back to some of our earlier conversations. They should be getting the consumers engaged far more than they are today.
And what should software development organizations be doing less of?
sitting around tables and just talking amongst themselves, which is wonderful and should happen. But at the end of the day, we are here to develop for consumers. And so less of the echo chamber, more of having honest conversations with consumers.
Yeah, it's hard to picture more of an echo chamber than a closed office, right? And finally, what is something that you are hopeful for?
Oh, I am very hopeful that through intelligent implementation of AI, we can have better health and care for everyone. I am very excited about that and very hopeful that we're going to be able to get there together.
Well, thank you so much for joining us. It's been a wonderful conversation, and we appreciate having you. Thank you so much.
Thank you, David. Really appreciate the conversation.
What a pleasure to talk with Dr. Nasim Afsar. You can find her book, Intelligent Health, The Movement to Unify Data, Harness AI, and Empower People to Thrive in our podcast notes. Thank you to our producers, Joe Stella and Samsu Sala, editor Ian Lippincott, and graphic designer Carly Searles. Subscribe to Ready Test Go on your favorite podcast player, or watch our video episodes on our website, applause.com. You can also subscribe to the Applause YouTube channel, and the handle for that is applause.com. If you have feedback or a guest recommendation, we'd love to hear from you, so go ahead and reach out to us directly at podcasts@applause.com. Thank you for joining us.